apex of the heart, but I can tell it's the ventral side easily. Well, yours was cut very low, but the pulmonary trunk would be right here. The pulmonary trunk would be the vessel that you can see really like up front in your face from the ventral side. And you can see that it's clearly associated with the right ventricle. So we've got the right side, the left side. The right atrium has been cut off. Here's the right ventricle, the left atrium, and the left ventricle. The pulmonary trunk, the aorta is dorsal to the pulmonary trunk. This has been cut off too low, but you can see if you kind of go like this, that the posterior vena cava would enter right there, and the anterior vena cava would enter right there. And then coming into the left atrium, we've lost the top of it, but basically we'd have two openings there, which would be the two pulmonary veins coming from the lungs. The interventricular septum is that wall that you can see. I'm not really sure what you want me to do in the video.
Is the atrial and the interventricular septum connected?
Well, kind of. The interventricular septum is going to be between the two ventricles. The interatrial, there's an interatrial sulcus, which is basically right here. A sulcus is a groove. That really reflects where the atrioventricular valves are, because that's really the division. There's not so much a wall between the two chambers, the atrium and ventricle. It's more that there's the valves. You've got atrioventricular valves between an atrium and a ventricle. You've got a right and a left AV valve. You can also use the human terms. I like the AV, atrioventricular valves, because it tells me exactly where they are, but you are very welcome to use the human terms instead. The semilunar valves are up here. I think this would have worked well in this one too. I was trying to do the water test. Is that water bottle still there?
Yeah.
Can somebody grab that? I think it's going to work well. The semilunar valves, remember, are the more bucket style ones. And you can see how, if you can kind of peer into that hole, when the blood comes up out of the ventricle, the valves get moved out of the way very easily. But when the blood tries to backflow, these little buckets kind of come out like that. You see how it's sort of flapping in the way? Now, this is because it's been dissected and they're not all quite in the right place. It's leaking. But you can get an idea, at least, I think, of how the water would be held, the blood would be held by the semilunar valves.
Can we see like the trabecular muscles?
Trabeculae carneae it's referring to the ventricular walls where they have all these kind of stringy, crisscrossy parts of the muscle. It's still cardiac muscle. This is the ventricular myocardium, but that, I kind of think of it as a style of muscle. Like there's this crisscrossy look of the myocardium, and the ventricles is the trabeculae carneae. In the atria, which you guys have lost a lot of here, but you can see in the atria how there's also these stringy, crisscrossy areas. They're smaller, narrower. These are called pectinate muscle when it's in the atria. Let's see, we did all those blood vessels up there,
Can we see
right?
like the Fossa Ovalis and the...
It's very hard to actually see it. To understand the Fossa Ovalis, you really have to start with the fetus, a mammal fetus, that gets all its oxygen from mom through the placenta. And because there's no real need to send blood to the lungs are filled with fluid, it would just be a lot of effort and delay in delivering the oxygen to send the blood out to the fetal lungs. So in the fetus, in the wall between this right and left atrium, there's a hole, and it's really cool. When we do the fetal pig dissection, you're going to see it. It's this big honking hole that you're not going to believe is there. And that means, if you look at the picture on the board, blood in the right atrium, a lot of it goes straight through that hole into the left atrium, and that means that it bypasses that whole pulmonary circuit. And then when the baby's born and all of a sudden they need their lungs, they're not attached to the placenta through an umbilical cord anymore, that hole kind of gets folded over, and then over the next few weeks to months it heals over, and it leaves a scar called the Fossa Ovalis. And because this is from an adult sheep, what we're trying to find is the Fossa Ovalis. And I would say right there, do you see there's sort of a little depression?
I was so wrong.
And when you touch it, it feels hard, like scar tissue is hard. So I would say that right there is where the Fossa Ovalis is.
Is that in the right atrium?
It's in the wall between the right and the left atrium. This is the right atrium, this is the left atrium, and the part I was holding is like right where I'm pinching.
Okay.
Can we see like the coordinate tendinae, papillary muscles, semilunar valves?
All of it.
Everything. Everything.
Okay. Atrioventricular valves are these flaps. Okay? And when the ventricle contracts and the blood tries to backtrack, it catches the flap. And really there's either 2 or 3 flaps, and they come up and they create a barrier between the ventricle and the atrium. That's the AV valve itself. Okay, but there are these strings attached to it, which are called chordae tendineae. And if it didn't have the string, a little demo going, the blood would push the valve closed, and it would just keep going. And then the blood would go out back to the atrium. That's no good. So instead, there are these chordae tendineae, and it stops the valve where it should stop. Okay, so that's the chordae tendineae part. But in addition to that, we have these papillary muscles right here at the base where the chordae tendineae go into the myocardial wall. Because look what happens when you have the valve say is closed like that, the chordae tendineae are holding it and it's nice and tight, but when the ventricle contracts, look what happens to the strings. They loosen up, okay? And that would let the valve go too far up. So what happens is that as the ventricle contracts, the papillary muscle contracts in the other direction, and it pulls the string tight again. And that way the valve closes and it actually stays in the right closed position.
So is the papillary muscles at the base?
Yes.
Okay.
So from your perspective, this is the ventricle down here. The papillary muscles are down here, like right at where the string goes into the wall.
Okay.
And they're contracting like this, and that way when the ventricle goes like that, the papillary muscle does it in the opposite direction, and the string stays tight.
And that's it, right?
Anything else?
We
Do you
have the
guys
number.
understand what the visceral pericardium versus a parietal pericardium is?
Viscera adheres to the organ, parietal surrounds the cavity, right?
Right. So organs have a membrane lining them, and it makes them kind of smooth and slippery, and you don't usually realize it's there until you try to take it off. And then you go like that, and you're like,
That's the viscera.
that's the visceral pericardium.
Okay.
Okay, and then in the lining the chamber for whatever organ, there's going to be a parietal, and then you name it based on what chamber it's in. And the idea is that if the visceral pericardium is on the organ and it's all slippery and smooth, and then the chamber has a similar slippery, smooth membrane, then they can just slip and slide past each other instead of kind of getting stuck and having friction damage. The parietal pericardium is, in this case, also called the